So, good day everyone. I am Monalyn Grace Bansil and I am the first reporter for the schizophrenia spectrum and other psychotic disorders. So, we will be tackling about the schizophrenia spectrum and other disorders like delusionals, hallucinations, and other psychotic disorders. Start. So, psycho schizophrenia spectrum and other psychotic disorders, they are defined by abnormalities in one or more of the following five domains: the delusions, hallucinations, organized thinking or speech, grossly disorganized or abnormal motor behavior, including catatonia and negative symptoms. So, delusions are fixed beliefs that are not amenable to change in light of conflicting evidence. Their content may include a variety of themes. So, delusions, hindi lang siya isa lang na delusions. May mga subtypes ito siya. So, what are the subtypes? First subtype is the persecutory delusions. Persecutory delusions are most common. Small slights may be exaggerated and become the focus of the delusional system. The affected individual may engage in repeated attempts to obtain satisfaction by legal or legislation action. So the example of persecutory delusions is that being spied on by someone who means harm, or who is part of the conspiracy, being followed or tracked, being lied to or given misinformation. So ang persecutory delusions, ito yung kahit konti lang na na mga situation or bagay-bagay, exaggerated na siya masyado, and nagfo-focus na siya sa kanyang delusional system na may someone na gustong mag-harm sa akin, or someone na may nagaspy sa akin, ganyan. So, wherein hindi naman siya totoo or hindi siya nag-exist. So, the second delusion is the referential delusion. So, referential delusion is, for example, is a belief that certain gestures, comments, environmental cues, or so forth are directed and at oneself and are also common. So one of the example of referential delusion is when someone watches a movie and believes there is a message in the movie that is meant specifically for them, that makes some kind of sense. So yung referential delusions, alam niyo naman siguro yung case ng Magwad siblings na the killer killed the uh the killer killed the two children kasi nga nanood siya sinasabi ng sa investigation na yung ampun good siya na pinatay niya yung totoong mga anak para siya yung maging tunay na anak. So parang na-embody niya ba yun, or sa isip niya mismo na parang connected siya doon na she needed to kill also the daughters of the teachers or the principals or the parents of the daughter of Magwad family, in order for her to become also the um yung nag-iisang anak din. Pinatay niya yung dalawa. So nagkaroon siya ng referential delusions na parang gi-align niya yung life niya dun sa movie na na-watch niya, kasi parang na-incline siya masyado sa movie na gi-watch niya. Third delusion is the grandiose delusion. So, grandiose delusion is when an individual believes that he or she has exceptional abilities, wealth, or fame. So, one of the example of grandiose delusion is a person may believe, for instance, that they are famous, can end world wars, or that they are immortals. So, yung grandiose delusions, yung kahit hindi naman parang naga-believe siya na meron siyang exceptional abilities na kaya niyang lumipad or kaya niyang mag-disappear o maging invisible. So, they are having grandiose delusions kasi hindi naman yung totoo. Yun. Next is the erotomanic delusions. So, erotomanic delusions, the person about whom this conviction is held is usually a higher status but can be a complete stranger. Efforts can contact to contact the object of the delusions are common. So, one of the example of the erotomanic delusions, people with this type of delusional disorder believe that another person or often someone important or famous is in love with them. So they may attempt to contact the person of the delusion and engage in stalking behavior. So itong erotomanic delusions, kaya siguro there are some people na naniniwala na yung mga avid fan is meron din silang skits kasi nga may delusion sila na parang in love sa kanila yung ganito kasi nga sometimes they proclaim that someone is an idol is their husband or their wife na nag-aabot na siya sa na yung delusion niya na yun parang na ma-embody niya na good na mag-attempt na siya na stalk yung person, yung mga paparazzi ba yung tawag dyan or ano ganit tawag sila. So sa mga K-pop good, saseng. O yun, saseng ang tawag sa kanila. Next. Next type of delusion, subtype of delusion is the nihilistic delusions. So it involves the conviction that a major catastrophe will occur. So one of the example of nihilistic delusion is delusion it is a delusional belief of being dead, decomposed or annihilated. So kung alam yung term na annihilated, kung sino yung naka-watch ng Annihilation na movie, yung matouch mo lang yung parang mga nasa magical place sila tapos pag may matouch ka na something is ma-disappear ka na good, parang mawala ka or nang awag sina do gitubuan ka gud sang mga maging bulak ka, tubuan ka sang bulak, ana good. Basta Annihilation to siya nga movie. Watch niyo kung enami to siya. So, or having lost one owns internal organs or even not existing entirely as a human being. So, yung mga taong may delusions na ganito, sila ay naniniwala sila na patay na napatay daw sila or na-decompose na daw sila, ganyan. Or bisag wala gud sang tahi ang kilid nila, they believe na merong may isa ka internal organs na nawala sa kanila, ganyan good. So, next delusion is the somatic delusion. So, somatic delusion feels afflicted by a physical defect or general medical condition. For example, fear of infestation or infection. They often believe that they've been infected by parasites that have taken over their internal organs or by tiny insects that have burrowed under their burrowed under their skin to lay their eggs. So, yung may tendency na magkaroon ng somatic delusion, ito yung mga OC masyado good sa cleanliness nila. Kasi, takot sila na parang feeling nila pag hindi sila nakagawa ng mga bagay na dapat na gawin nila, magkaroon sila ng mga parasite sa katawan, mga internal organs nila is parang feeling nila parang napuno gud sila ng mga worms or something, insects ba. Next type is the jealous type. So the censored theme of the delusion is that of an unfaithful partner. This belief is arrived at without due cause and is biased on incorrect inferences supported by small bits of evidence. So the individual with the delusion usually confronts the spouse or lover and attempts to intervene in the imagined infidelity. So, ang example nito, no, they believe that their spouse or sexual partner is unfaithful without any concrete evidence. So, this applies to feeling ko mga babae or mga may trust issues kasi nga bisag wala gud sang concrete evidence, they believe na yung partner nila is unfaithful or naga-cheat, ganyan. Bisag walay concrete evidence. So, delusions that express a loss of control over mind or body are generally considered to be bizarre. So, the first bizarre is yung thought withdrawal and the thought insertion. So, ang thought withdrawal, the belief that one's own thought have been removed by some outside force. So, for example, thought have been taken out by the patient's mind. If the company's thought blocking, the patients may experience a break in the flow of their thoughts, believing that the missing thoughts have been withdrawn from their mind by some outside agency. So, feeling nila yung mga patients good na parang um from ano ganito siya na parang ano ba ng sa isa ka situation, a doctor and a patient. Ang patient naga-believe siya nga magi-remove ang doctor sa iya wherein wala man gihapon. Like ing anak god. So ang isa is the thought insertion that alien thoughts have been put into one's mind. So sa alien insertion, parang ang example niya is she said that sometimes it seems to be her own thought but don't get the feeling that it is. So sa thought insertion naman, parang kung parang naga-tell good siya nga parang feeling niya parang sa kanya yung mga words wherein parang hindi niya din naman ay parang sa isip niya sa kanya yung words pero hindi niya ma-feel na sa kanya talaga yung words. Parang gi-insert lang good siya na parang um someone took her ano tawag diyan. Someone inserted thought sa mind niya na parang hindi man galing yun sa kanya pero bakit nasabi niya yon. Next is the delusions of control. One's body or action are being acted on or manipulated by some outside force. Force. So one of the example is a person believes others trying to control their thoughts and behavior. My doctor is trying to plant thought inside my head. So that is one of the example of delusions control. So parang same good siya ng parang kabaliktaran siya ng thought withdrawal at saka yung delusion sa delusions control kasi yung thought withdrawal is feeling nila is inalisan sila ng thoughts ng doctor niya wherein sa delusions of control iniisip niya naman na yung doctor niya is parang ginatry talaga ng doctor niya na makaplant ng thoughts sa isip niya wherein hindi naman yun totoo. Parang nakokontrol niya na yung mga delusions niya na hindi naman pala totoo, bakit siya naniwala, no? So, second is the hallucination. So, hallucinations are perception-like experiences that occur without any external stimulus. So, they are vivid and clear with full force and impact of normal perception and not under voluntary control. They may occur in any sensory modality, but auditory hallucination are the most common in schizophrenia and related disorders. So, ang hallucination, nangyayari siya actually sa visual hallucination, yung kahit wala kang nakikita, parang may nakikita ka. Pero the most common one is the auditory hallucination when it comes to schizophrenia. So, that is why i-discuss ko yung auditory hallucinations. Kasi, meron akong isang documentation na na-watch na may schizophrenia siya na makakarinig na grabe kadami yung marinig niya na voice na minsan yung isa doon nagsasabi ng um, bad side na dapat niyang sabihin tapos yung isa parang gina-clear yung mind niya na hindi kaya mo yan ganito ganyan there are may mga things pa na pwede mong gawin sa mundo pero yung isa nagsabi hindi mo na yan kaya parang ganun daw so yun yung sa documentation basta voices yung title niya na na-watch ko. So, auditory hallucination are usually experienced as voices, whether familiar or unfamiliar, that are perceived as distinct from individuals' own thoughts. So, nag-search ako what are the different example of auditory hallucinations, kung ano ba yung mga naririnig nila, possible na marinig nila. So, yung mga lumabas doon is mga animal sounds daw, makarinig daw sila ng mga ganyan, mga 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 tumatatak sa isip nila ng mga words na sinabi ng tao sa kanila, and then yung mga pangkaraniwang naririnig nila sa labas. Kasi yun siya, pag abot, parang kwan yung auditory hallucination niya, yung babae na yun, ng always siya naka-headset. So, some people daw is judging her kasi nga, um, some people are judging her kasi nga, mag-isa siyang nagsasalita na kinakausap niya yung mga naririnig niyang voices, even though meron siyang earphones or earpads sa ear niya. So, the hallucination must occur in the context of clear sensorium. Like, for example, the hypnagogic and the hypnopompic. So, these two are considered to be within the range of normal experience. So, hallucinations may be part of religious experience in certain cultural contexts. They may seem mistaken for nightmares kasi nga nangyayari ito na hallucination yung hypnagogic while falling asleep. While yung isa, yung hypnopompic, nangyayari naman siya sa paggising mo. So, mistaken siya minsan na nightmare siya, and they can occur while sleeping, while falling asleep nga, yun nga, yung hypnagogic, and waking up hypnopompic. So, during this hallucination, you may feel someone's touching you, hear sounds or words, or see people or creature near you, or even laying in your bed. So, yun daw yung mga nakikita mo if you're having this kind of hallucination. Na minsan nga, na parang nami-mistake siyang, parang naano siya good. Akala mo ginightmare ka na. Pero yan pala yung nangyayari sa'yo. Next is the disorganized thinking or speech. So, disorganized thinking or formal thought disorder typically inferred from the individual speech. So, one example of disorganized thinking is talking too fast and loud or in a garbled manner, strange pauses, incoherent tangents of thought, excessive detail. Parang kahit hindi na siya ginaas sa'yo, parang ginasabi mo pa din. Kasi nga, disorganized yung pag-iisip mo. Hindi siya pareha sa normal na tao na nakahanay siya. So, second is the derailment or loose association. The individual may switch from one topic to another. So, parang yung derailment, yun nga, hindi pa nga natapos yung isang topic, nag-switch naman siya into another. Parang, maraming nagalabas sa isip niya na hindi niya matapos i-discuss kasi nga marami from one topic to another siya, parang ma-open niya lang tapos hindi niya ma-close kasi nag-switch naman siya into another, ganun. The tangentiality answers to question may be obliquely related or completely unrelated. For example, when a therapist poses a question, how was your week? So a person may respond, when I was 5, my cat was killed. When the therapist asks about the cat, the person then begin to discuss something completely different, such as religious belief or previous illnesses. So, ari naman siya, di ba, answers to question may be obliquely related or completely unrelated. So, lain iya nga question, lain ang gisabat sa iya. So, kung sa aton na normal na tao, parang sarcastic, do ginabuang-buangan kagod, pero para sa may mga sakit nga, parang may disorganized thinking, isa ni siya ka symptoms or parang something nga subtype, yung tangentiality, nga, lain ang gi-question sa iya, lain iyang sabat, tas kung i-question sa iya tong gi-answer niya, lain po diyang sabat pod. So, ingana. Next is the coherence or word salad. So, I know that you know already what is word salad. So, speech may be so severely disorganized that it is nearly incomprehensible or resembles receptive aphasia in its linguistic disorganization. So, one of the example is when someone who was diagnosed with schizophrenia uses a string of unrelated words. Psychologists call it schizophasia. Other example of word salad include "What is this?" clanging, in which the affected person speaks in rhyming and other pattern ways but without making any sense. Uh, next is next is grossly disorganized. So, when grossly disorganized or abnormal motor behavior may manifest itself as a varieties of ways, ranging from childlike silliness to unpredictable agitation. So, yung catatonic behavior is a marked decrease in reactivity to the environment. This ranges from resistance to instruction, negativism, to maintaining a rigid, inappropriate, or bizarre posture, to complete lack of verbal and motor responses, or rheumatism and staph. It can also include purposeless and excessive motor activity without obvious cause or the catatonic excitement. So, this part, itatackle siya mamaya ni Ate Weng. Kasi yung catatonic behavior, parang doon pa yun siya, matakil pa yun siya ahead. Parang ito kasi, parang gist lang kung ano yung dapat nating matutunan sa chapter na to. Parang you have to understand this. Next is the negative symptoms. So, negative symptoms account for a substantial portion of the morbidity associated with schizophrenia but are less prominent in other psychotic disorder. One of the example of negative symptoms is losing interest or motivation in life and activities, including relationship and sex, lack of concentration, not wanting to leave the house, and changes in sleeping, patterns. Parang, so, yun na nga, parang yung negative symptoms, yun yung example niya, guys. Yung parang nawawalan ka na ng gana or motivation in life. Na kahit yung pag-alis ng bahay, hindi mo na magawa. Or even, nag-change ka na ng sleeping pattern mo. Like, dati you used to sleep 8 p.m. but now you're sleeping 1 a.m. Then, you're gonna hugtaw na ka, kuan na, mga hugto na, or unlike before na, very early pa ka maghugtaw para mas energetic imong day. So, next is the diminished emotional expression. Includes reductions in the expression of emotion in the face, eye contact, intonation of speech, prosody, and movements of the hands, head, and face that normally give an emotional emphasis to speech. So, one of the example, for example, a person recalling their father's death might simply recount the factual details of the death. The person may not share much information about how they felt. They may show little facial expression or speak in a monotone voice. So, ito yung mga diminished emotional expression. Parang yung emotional expression mo, like yung mga expression ng mukha mo, yung eyes mo, ang intonation ng speech mo, ang movement ng hands mo or head, parang hindi na good siya like before na very expressive. Parang wala na siya masyadong emotion. Actually, this happens to people na naka-feel talaga ng death or parang traumatic events or something. Next is the abolition is a decrease in motivated self-initiative purposeful activities. The individual may sit for a long period of time and show little interest in participating in work or social activities. So, example of abolition in schizophrenia might be the inability to care for personal hygiene or participate in work or recreational activities. So, ang abolition, amo ni siyang kadamakan, siya lang. Amo ni siyang, parang hindi ka na nag-care for yourself, na wala ka ng personal hygiene or participation in work nga you used to do Next is the alogeia. Alogeia is manifested by diminished speech output. For example, you may not talk because you hear voices that tell you not to talk, or you might not talk because you feel nervous or ay next delete na wait lang. You might you might not talk because you feel nervous or paranoid around people. So, ang alogeia, may siyang do parang di ka na maghambal. You don't want to talk anymore. Mm-mm. Just because you have this paranoia around other people. So, next is the anhedonia. Wow, namin yung mga terms. Anhedonia is the decreased ability to experience pleasure from positive stimuli or degradation in the recollection of pleasure previously experienced. So, for example, these are symptoms that indicate the absence of something like pleasure or motivation. Yung kanina, for example, an absence of pleasure, known as anhedonia. It's common negative symptoms associated with schizophrenia. So, ang example nito, yung kawalan ng pleasure sa iyo, not specifically sa sexual, no? Halimbawa, you used to love painting or drawing. It gives you pleasure to do things. But then, today, something happened to you, and then, kahit ano yung gawin mo na you used to like na that gives you pleasure, hindi na siya nagbibigay ng pleasure like it used to be. Char lang. Yun. Like before. So, yun yung nangyayari. May anhedonia ka na. Kasi nga, mag-decrease na yung ability mo to experience pleasure. Parang pili na lang. Swerte na lang kung meron. Yun. So, next is the asociality. So, asociality refers to the apparent lack of interest in social interactions and may be associated with abolition, but it can also be a manifestation of limited opportunities for social interaction. So, a reduction in social initiative due to decreased interest in forming close relationship with others. So, asociality, ito naman is the lack of interest in social interaction. It can also associated with abolition, which I mean is yung damak kani. Abolition ba yung damak? Check natin kung yun talaga yung kay basi mali ako ba. Yun, yung inability to care, personal hygiene. So, like asociality, parang pwede siyang ma-associate sa abolition, but it can also be a manifestation of limited opportunities for social interaction. Bawa, as a child, merong mga bata na pinalaki na after school, nagalaro na talaga yun sila sa labas. Pero may mga bata din na after school, mag-study pa yan sila kasi yun yung parang naset sa mind nila na I have to study kasi mag-aral si mama and that and all. So, sa paglaki na nila, parang di na good nila alam kung parang limited masyado yung opportunities nila to socialize or to interact with other people or parang nawalan na lang talaga sila ng gala into social interactions kasi hindi nila alam paano. Kasi they are not used to that interactions. Next, we will discuss the diagnostic criteria for delusional disorder. So, ito na po, papunta na po tayo sa amazing, sa pinaka-exciting part. Umpisahan na natin. So, the first diagnostic criteria is the presence of one or more delusions with a duration of 1 month or longer. So, yung mga sinabi ko na mga subtype of delusions like the persecutory delusions, the jealous type, pag meron sila noon na parang present yun sa kanila at yung delusion na yun is nagatagal siya ng 1 month or mas matagal pa, pasok sila sa criteria A. So, next is the B. So, criterion A for schizophrenia has never been met. So, sa B naman, Parang kung hindi nila, parang sa criterion A, hindi pa na-met masyado. So, sa C, apart from the impact of the delusions or its ramifications, functioning is not markedly impaired or behavior is not obviously bizarre or odd. Sa criterion D, if manic or major depressive episodes have occurred, these have been brief relative to the duration of the delusional period. So, if meron ng manic and major depressive episode na nangyayari, ma 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 marirelate na siya sa duration ng mga delusional periods. So, the disturbance is not attributable to the physiological effects of a substance or another medical condition and is not better explained by another mental disorder such as body dysmorphic disorder or obsessive compulsive disorder. So, ano bang kailangan nating i-specify dito? So, let's specify whether it is a Eromani type, yung mga sinabi ko kanina. Yung ito na subtype is applies when the central theme of the delusion is that another person is in love with the individual. Pag nakapasok siya dyan, kailangan mo yung i-specify. Grandiose type applies when the central theme of delusion is the conviction of having some great or unrecognized talent or insight or having made some important discoveries. Parang feeling niya siya yung nakakita ng dinosaur. Yun. Jealous type, this subtype applies when the central theme of the individual's delusion is that his or her spouse or lover is unfaithful. Amni siyang mga pataka lang good, bisan wala evidence, di go, char lang. Ano siya. Next is the persecutory type. Ang central theme naman nito is it is the individual's belief that he or she is being conspired against, cheated, spied on, followed, poisoned, or drugged maliciously. Ito yung mga may trust issues. Kahit wala namang nangyayari or wala namang nag-spy sa kanila or nagasunod sa kanila, feeling nila meron. So, next is the somatic type. Ang subtype naman na ito is it involves bodily function or sensations. Nasabi ko na yun kanina. Next is the mixed type. This subtype applies when no one delusional theme predominates. So, sa mixed type, halimbawa, merong present ang persecutory type, present din ang jealous type, at saka yung erotomanic. Ibig sabihin, parang present sila doon, pero walang parang mas more on persecutory type siya, ganyan. So, parang timbang lang yung lahat, balance lang na presence na ganito, parang wala nakakalamang sa tatlo, kaya ginawa siyang mixed type. Next is the unspecified type. This subtype applies when the dominant delusional belief cannot be clearly determined or is not described in a specific type. Like, for example, sa grandiose type. This subtype applies when the central theme of the delusion is the conviction of having some great but unrecognized talent or insight or having made some important discoveries. Yun. And also, specify din natin with bizarre content, delusions are deemed bizarre if they are clearly implausible, not dependable, or not derived from the ordinary life experiences. And also, specify the following courses, specify years are only to be used after 1 year duration of the disorder. To be used after pa ng 1 year duration ng disorder. So, first episode or the currently in acute episode, first manifestation of the disorder meeting the defining diagnostic symptoms of the time criteria. An acute episode is the time period in which the symptom criteria are fulfilled. Pag na-fulfill niya yung lahat ng criteria na sinabi natin kanina from A to ano ba yan? From A to D ba yun? Basta yun, yung lahat ng criteria na yun, nakapasok na siya sa first episode. So, next is the first episode na acute episode ba? Nakapasok na siya doon. So, next is the partial remission. So, partial remission is the time period during which an improvement after a previous episode is maintained and in which defining criteria for the disorderly disorder are only partially fulfilled. So, sa partially remission, ito naman yung time or period na parang nag-improve na yung mga episodes niya, na maintain na yung mga defining criteria of the disorder, ma-fulfill niya na, ganyan. So, sa full remission naman is the period of time after a previous episode during which no disorder-specific symptoms are present. So, sa full remission, dito na mapupunta yung parang kung sa partial remission, parang kung meron pang parang nasa half pa lang siya, baka partial man, nasa half pa lang siya. Pag sa full remission na, ang mga previous episodes niya during which no disorder-specific symptoms are present, nang wala na wala na agi, sang kagapon. So, ano ba mga diagnostic features ng delusion? So, the essential feature of delusion is the presence of one or more delusions that persist for at least 1 month creation. 1 month. Nakabutang na siya sa criterion kagina ha. So, a diagnosis of delusional disorder is not given if the individual has ever had a symptoms presentation that met criterion A for schizophrenia. Yan yung sa criterion B. Sa criterion C, apart from the direct impact of the delusion, impairments in psychosocial functioning may be more circumscribed than those seen in other psychotic disorders such as schizophrenia, and behavior is not obviously bizarre or odd. So, if mode episode occur, criterion D, currently the delusions and the total duration of this mode episode is brief relative to the total duration of the delusional periods. So, associated features supporting diagnosis. So, ano ba yung mga supporting diagnosis dito? Social, marital, or work problems can result from the delusional belief of delusional disorder. So, mga problems niyan dyan sa mga social, marital, kasi nga merong jealous type doon kanina sa delusion. Work problems, yun. Yung sa social, yung sa asociality, kanina sa hallucination, ay sa negative symptoms pala, sorry. So, individuals with delusional disorder may be able to factually describe that others view their beliefs as irrational but are unable to accept this themselves. For example, there may be factual insight but not true insight. Walang katotohanan. So, many individuals develop irritable or dysmorphic mode, which can sometimes be understood as a reaction to their delusional belief. Anger and violent behavior can occur with persecutory, jealous, and eromanic type. The individual may engage in litigious and antagonist behavior. For example, sending hundreds of letters to protest to the government. Yun. So, legal difficulties can occur particularly in jealous and eromanic type. So, what is the prevalence? The lifetime prevalence of delusional disorder has been estimated at around 0.2%. And the most frequent subtype is persecutory. Delusional disorder, jealous type, is probably more common in males than in females. Masiluso, laging lalaki lagi. But there are no major gender differences in all over frequency of delusional disorder or in the content of the delusions. So, ibig sabihin, that concludes that, sa jealous type, mas common siya sa mga lalaki kaysa sa females. So, ano boys, abin nyo lang ha. Next. The development and course, on average, or global function is generally better than that observed in schizophrenia, although diagnosis is generally stable. A proportion of individuals go on to develop schizophrenia, where about a third of individuals with delusional disorder or of 1 to 3 months duration subsequently receive a diagnosis of schizophrenia. So, delusional disorder is much likely to change if the duration of the disorder is greater than 6 to 12 months. So, although it can occur in younger age groups, the condition may be more prevalent to older individuals. So, bisan ano, nangyayari siya sa mga bata pa or mga teenagers pa. Pero mas prevalent pa rin siya sa mga older individuals. Kasi nga, yung mga older individuals, sila yung mga ma-furniture lang. Sila yung may mga maraming iniisip kaysa sa mga bata noon pa. So, risk and prognostic factors. First is the genetic and physiological. So, delusional disorder has a significant familial relationship with both schizophrenia and schizotypal personality disorder. The culture-related diagnosis issues, an individual's culture and religious background must be taken into account in evaluating the possible presence of delusional disorder. In fact, some traditional beliefs unfamiliar to Western culture may be wrongly labeled as delusional, so their context must be carefully assessed, and the content of delusion also varies across cultural contexts. Functional consequences of delusional disorder. So, the functional impairment is usually more circumscribed than that seen in psychotic disorders. Although in some cases, the impairment may be substantial and include poor occupational function and social isolation. When poor psychosocial function is present, delusional beliefs themselves often play a significant role. A common characteristic of individual with delusional disorder is the apparent normality of their behavior and appearance when their delusional ideas are not being discussed or acted on. Men with delusional disorder generally have more severe symptoms and worse functional outcome compared to women. So, ito yung mga functional consequences. Kung poor ka sa psychosocial functioning, parang mas malaki yung mag-play na significant role mo, parang ang delusional belief mas magdako gud siya sa imo pag poor ang imong psychosocial functioning. Pag common naman ang characteristics of individuals, kung hindi gud siya nang balaan mo na ay if you know na ana jud ang characteristics sa ang individuals with delusional disorder, tapos hindi mo gud when their delusional ideas are not being discussed or acted on, nang may mga matabong consequences. Men with delusional disorders generally have more severe symptoms and worse functional outcomes compared with women. So, yun na nga, yung mga lalaki na may delusional disorder, mas severe yung mga symptoms and saka yung mga functional outcomes nila compared sa babae. Kaya mga aggressive na sila, char lang. Basta, mas taas gidang sa men. So, what are the differential diagnoses? First diagnosis is the obsessive, compulsive, and related disorders. So, if an individual with obsessive compulsive disorder is completely convinced that his or her obsessive compulsive disorder beliefs are true, then the diagnosis of obsessive compulsive disorder with absent insights, delusional beliefs specifier should be given rather than a diagnosis of delusional disorder. Similarly, if an individual with body dysmorphic disorder is wait lang. Similarly, if an individual with body dysmorphic disorder is completely convinced that his or her body dysmorphic disorder beliefs are true, then the diagnosis of body dysmorphic disorder with the absent insight delusional belief specifier should be given rather than a diagnosis of delusional disorder. Lah, same ba ni? Naliwat niya. Next. Next differential diagnosis is the delirium major neurocognitive disorder, psychotic disorder due to another medical condition, and substance medication in those psychotic disorder. So, individual with these disorders may present with symptoms that suggest delusional disorder. For example, simple persecutory delusions in the context of major neurocognitive disorder, we would be diagnosed as major neurocognitive disorder with behavioral disturbance. So, ari mga combination na ni siya, guys. Kung may ara ka daw sang simple lang gid nga persecutory delusion, pwede ka mahulog sa major neurocognitive disorder or with behavioral disturbance ka pa. A substance medication in those psychotic disorder cross-sectionally may be identical in symptomatology or to delusional disorder but can be distinguished by the chronological relationship of substance use to the onset and remission of the delusional beliefs. So next is the schizophrenia and schizophreniform disorder. These two will be discussed mamaya yung mga criteria nila. But here, belong siya sa differential diagnosis. So delusional disorder can be distinguished from schizophrenia and schizophreniform disorder by the absence of the characteristic symptoms of the active phase of schizophrenia. Furthermore, the quality of delusion can help distinguish between schizophrenia and delusional disorder. In schizophrenia, delusion shows greater disorganization. For example, the degree to which delusions are internally consistent, logical, and systematized. Whereas the delusional disorder, they show greater conviction or the degree to which the individual is convinced with the reality of the delusion. Greater extension, the degree to which the delusion involves various areas of individual's life, and the great pressure, the degree to which the individual is preoccupied and concerned with the expressed delusion. Oh, yun yung mga under dyan. Next is the depressive and bipolar disorder and schizoaffective disorder. Yung schizoaffective disorder, next yan siya, sunod yan siya sa schizophrenia mamaya. So, these disorders may be distinguished from delusional disorder by the temporal relationship between the mode disturbance and the delusions, and by the severity of the mode symptoms. If delusions occur exclusively during mode episodes, the diagnosis is major depressive or bipolar disorder with psychotic features. So, mode symptoms that meet full criteria for a mood episode can be superimposed on delusional disorder. So, delusional disorder can be diagnosed only if the total duration of the mood episodes remains brief relative to the total duration of the delusional disturbance. So, if not, then the diagnosis of other specified or unspecified schizophrenia spectrum and other psychotic disorder accompanied by another specified depressive disorder, unspecified depressive disorder, other specified bipolar and related disorder is appropriate. Yung lahat ng yun. So, next is the brief psychotic disorder. What are the diagnostics criteria for brief psychotic disorder? So, the first criteria, sa criterion A, presence of one or more of the following symptoms, at least one of these, must be 1, 2, or 3. So, first is the delusions. Kanina, sabi ko na yung parang hallucinations, disorganized speech, for example, a frequent derailment or incoherence, grossly disorganized or catatonic behavior. So, duration in an episode, yung sa B, sa next criterion, sa B criterion, sa criterion B, duration of the episode of the disturbance is at least 1 day but less than 1 month, with eventual full return of premorbid level of functioning. Sa criterion C, the disturbance is not better explained by major depressive or bipolar disorder with psychotic features or another psychotic disorder such as schizophrenia or catatonic, and is not attributable to the physiological effects of the substance. For example, a drug of abuse or medication or another medical condition. Yung mga physiological effects of substance is not attributable to drug or abuse of medication dito sa C. Parang maglabas yung mga delusions, yung mga hallucinations, disorganized speech, not because of the substance na na-induce sa body ng person na merong brief psychotic disorder. So, specify natin dito if with mark ang stressors, if symptoms occur in response to events that singly or together would be markedly stressful to almost anyone in similar circumstances in the individual's culture. So, without marked stressors naman, if symptoms do not occur in response to events that singly or together would be markedly stressful to almost anyone in similar circumstances in individual's culture. So, with peripartum onset, if onset is during pregnancy, within 4 weeks postpartum. I-specify pa din natin with catatonia, refer to the criteria of catatonia mamaya kay Ate Weng sa parang pagkatapos ng psychotic. Basta mamaya pagkatapos ko kay Ate Weng ma-discuss niya yung catatonia, mag-refer lang tayo sa criteria na nandoon. Next is i-code na coding note. Use additional code for catatonia associated with brief psychotic disorder to indicate the presence of the comorbid catatonia. Specify current severity. Yung severity ng brief psychotic disorder. Severity is rated by quantitative assessment of the primary symptoms of psychosis including delusions, hallucinations, disorganized speech, abnormal psychomotor behavior, and negative symptoms. Each of these symptoms may be rated for its current severity or most severe in the last 7 days. On a 5-point scale ranging from 0, not present, or to 4, present and severe. So, note lang na diagnosis of brief psychotic disorder can be made without using the severity specifier. So, ma-diagnose, sa diagnosis of brief psychotic disorder, magagawa natin yung diagnosis without using kung gaano ka-severe yung disorder. Next is the diagnostic features. The essential feature of brief psychotic disorder is the disturbance that involves the sudden onset of at least one of the following positive psychotic symptoms: delusions, hallucinations, disorganized speech, for example, frequent derailment or incoherence, or grossly abnormal psychomotor behavior, including catatonia, where is seen in criterion A. So, sudden onset. Ano ba yung sudden onset? No. So, sudden onset is defined as the change from non-psychotic state to a clearly psychotic state within 2 weeks, usually without a prodrome. An episode of the disturbance lasts at least 1 day but less than 1 month. And the individual eventually has full return to the premorbid level of functioning. So, what are the associated features supporting diagnosis? Individual with brief psychotic disorder typically experience emotional turmoil or overwhelming confusion. They may have rapid shifts from one intense affect to another. Although the disturbance is brief, the level of impairment may be severe, and supervision may be required to ensure that nutritional and hygienic needs are met and that the individual is protected from the consequences of poor judgment cognitive impairment, or acting on the basis of the delusions. So what are the differential diagnoses in this disorder? First, differential diagnosis is the other medical condition. A variety of medical condition can manifest with psychotic symptoms or of short duration. Psychotic disorder due to another medical condition or delirium is diagnosed when there is evidence from the history of physical examination or laboratory tests that the delusions or hallucinations are the direct physiological consequences of specific medical condition. For example, crashing syndrome, brain tumor, mga ganon. So, this is psychotic disorder due to another medical condition later in this chapter. So, madidiscuss yung mga, yung katatonia, madidiscuss siya after the psychotic disorder due to another medical condition. Nagasunod yan siya dun, guys. So, next is the substance-related disorder. Substance-related disorder, Charlo. Substance medication in those psychotic disorder. Substance-induced delirium and substance intoxication are distinguished from brief psychotic disorder by the fact that a substance, for example, a drug of abuse, a medication, exposure to a toxin, is judged to be etiologically related to the psychotic symptoms. Mamaya matakel natin yan sa substance medication in those psychotic disorder. So, laboratory tests such as the urine drug screen or blood alcohol level may be helpful in making this determination, as may a careful history of substance use with attention of temporal relationship between substance intake and onset of the symptoms and the nature of the substance being used. Next, the differential diagnosis is the depressive and bipolar disorders. The diagnosis of brief psychotic disorders cannot be made if the psychotic symptoms are better explained by a mode episode. For example, the psychotic symptoms occur exclusively during a full major depressive, manic, or mixed episode. Yon. Other psychotic disorders, yung next natin differential diagnosis. If the psychotic symptoms persist for 1 month or longer, the diagnosis is either schizophreniform disorder, delusional disorder, depressive disorder with psychotic features, bipolar disorder with psychotic features, or other specified or unspecified schizophrenia spectrum, or other psychotic disorder depending on the other symptoms in the presentation. The differential diagnosis between brief psychotic disorder and schizophreniform disorder is difficult when the psychotic symptoms have remitted before 1 month in response to successful treatment with medication. Careful attention should be given to the possibility that the recurrent disorder, for example, the bipolar disorder, recurrent acute exacerbations, or schizophrenia, may be responsible for any recurring psychotic episodes. So, next is the malingering and factitious disorder. So, an episode of factitious disorder with predominantly psychological signs and symptoms may have the appearance of brief psychotic disorder, but in such cases, there is evidence that the symptoms are intentionally produced. When malingering involves apparently psychotic symptoms, there is usually evidence that the illness is being feigned for an understandable goal. Personality disorder is also a differential diagnosis of this disorder. In a certain individuals with personality disorders, psychosocial stressors may precipitate brief periods of psychotic symptoms. These symptoms are usually transient and do not warrant a separate diagnosis. If psychotic symptoms persist for at least 1 day, an additional diagnosis of psychotic disorder may be appropriate. So, our next disorder is the schizophreniform. So, let's start with the diagnosis of the diagnostic criteria. So, schizophreniform. Sa criterion A, two or more of the following, each present for a significant portion of time during a 1 month period or less. If successfully treated, at least one of these must be one, two, or three. So, first is the delusion. Present pa rin sila yung kanina nag-discuss ko sa ating introduction. Delusions, hallucination, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. So, sa criterion B, an episode of the disorder lasts at least 1 month but less than 6 months. When the diagnosis must be made without waiting for recovery, it should be qualified as provisional. So, criterion C, schizoaffective disorder and depressive and or bipolar disorder with psychotic feature have been ruled out because either no major depressive or manic episodes have occurred currently with the active phase symptoms, or two, if the mode episodes have occurred during active phase symptoms, they have been present for a minority of the for the minority of the total duration of the active and residual periods of the illness. Sa criterion din natin, the disturbance is not attributable to the physiological effects of the substance. Hindi nga siya because of the mga physiological effects, hindi siya because of the substance na yung mga drug abuse or medical or another medical condition. So, specify natin with good prognostic features. Ano ba ang meron sa good prognostic features? The specifier requires the presence of at least two of the following features. Onset of prominent psychotic symptoms within 4 weeks of the first noticeable change in usual behavior or functioning. Confusion or perplexity. Good premorbid social and occupational function, and absence of blunt or flap effect. Next is without good prognostic features. This specifier is applied if two or more of the above features have not been presented. So, yun nga. Next, specify din natin siya with catatonia. Siyempre, magre-refer pa din tayo dun sa mga associated na mga other mental disorder under sa catatonia. Code lang natin, use additional, yun nga, indicate the presence of comorbid catatonia. Diagnostic features. So, the characteristic symptoms of schizophreniform disorders are identical to those of schizophrenia. Sa criterion A yan. Sa schizophreniform disorder is distinguished by its difference in duration, the total duration of the illness, including the prodromal, active, and residual phase, is at least 1 month but less than 6 months. Sa criterion B yan siya. The diagnosis of schizophreniform disorder is made under two conditions. One is when the episode of illness lasts between 1 or 6 months and the individual has already covered, and two, when the individual is symptomatic for less than 6 months duration required for the diagnosis of schizophrenia but has not yet discovered. So, what are the differential diagnoses? Other mental disorders and mental condition. A wide variety of mental and medical condition can manifest with psychotic symptoms that must be considered as differential diagnosis of schizophreniform. Of course, brief psychotic disorder, kasi nga yung schizophreniform, na-mention siya kanina sa brief psychotic disorder. Schizophreniform disorder differs in duration from brief psychotic disorder, which has a duration of less than 1 month. Parehas lang ang duration ng brief psychotic disorder. I mean, yun. Next is the schizophrenia. Oh my God, lapit na ta. Nasa tunga na ta. So, diagnostic criteria. First criterion, the criterion A, two or more of the following each present a significant portion of time during 1 month period or less if successfully treated. At least one of these must be 1, 2, or 3. Delusions, hallucinations, disorganized speech, grossly grossly disorganized or catatonic behavior, negative symptoms, under yan siya lahat sa criterion A. For a significant portion of the time since the onset of disturbance, level of functioning in one or more major areas such as works, interpersonal relationship, or self-care is markedly below the level of achieved prior to onset or when the onset is in childhood or adolescence. If there is a failure to achieve expected level of interpersonal, academic, or occupational functioning. So, sa C, ay, okay, sige, mag-proceed na lang to. Wala ko na ano ang severity. Kailangan nasa written report yung severity ng schizophreniform, guys. C is the continuous signs of the disturbance persist for at least 6 months. So, this 6 months period must include at least 1 month of symptoms or less if successfully treated that meet criterion and may include periods of prodromal or residual symptoms. During this prodromal or residual periods, the signs of the disturbance may be manifested by only negative symptoms or by 2 or more symptoms listed in criterion, are present in an attenuated form. D is the criterion D, schizoaffective disorder and depressive or bipolar disorder with psychotic features have been ruled out because either 1, no major depressive or manic episodes have occurred concurrently with the active phase symptoms. 2. If mode episodes have occurred during active phase symptoms, they have been presented for a minority of the total duration of the active and residual periods of the illness. Sa criterion E natin, the disturbance is not attributable to the physiological effects of the substance and or another medical condition, of course, kailangan yun. Hindi talaga siya yung mga nangyayari sa kanila is walang halong substances or another medical condition. So, F, if there is a history of autism spectrum disorder or a communication disorder of childhood onset, the additional diagnosis of schizophrenia is made only if prominent delusions or hallucination in addition to the other required symptoms of schizophrenia are also present for at least 1 month or less if successfully treated. So, sa diagnostic criteria, kailangan lang natin specify mga following core specifiers are only to be used after a year duration of the disorder. If they are not in contradiction to the diagnostic course criteria, first is the episode, concurrent episode, current acute episode. So, first manifestation of the disorder meeting a defining diagnostic symptoms and time criteria. An acute episode is a time period in which the symptoms criteria are fulfilled. Second episode, the next specifier is the partial remission. Yung first episode, partial remission is a period of time during in which an improvement after a previous episode is maintained and in which the defining criteria of the disorder are only partially fulfilled. Oh my. Next is the full remission. Sa full remission, ito yung period of time after a previous episode during which no disorder specific symptoms are present. Yun siya, guys. Next is the multiple episodes or the currently an acute episode. Sa multiple episodes naman, it is determined after a minimum of 2 episodes. For example, after a first episode, a remission, a minimum of 1 lapse. Okay? Gets? Of course, also, next, that is the partial remission, full remission. So, pag nag-continuous pa din siya, symptoms, sa continuous niya na process na sa specifier, symptoms of feeling the diagnostic symptoms criteria of the disorder are remaining for the majority of the illness course, with the sub-threshold symptoms periods being very brief related to all over course. Okay. Specify pa gid natin siya with catatonia pa din. Next is the diagnostic features. So, the characteristic symptoms of schizophrenia involve a range of cognitive, behavioral, and emotional dysfunction. But no single symptoms is pathonomic of the disorder. The diagnosis involves the recognition of the constellation of signs and symptoms associated with impaired occupational and social functioning. So, what are the associated features supporting the diagnosis? Individual with schizophrenia may display inappropriate affect gali. A dysmorphic mode that can take the form of depression, anxiety, or anger. A disturbed sleep pattern, a lack of interest in eating or food refusal. Depersonalization, derealization, and the somatic concerns may occur and sometimes reach delusional proportion. So, what are the risk and prognostic factors of schizophrenia? First is the environmental. Seasons of birth have been linked to the incidence of schizophrenia, including late winter or early spring in some locations and summer for the deficit form of the disease. The incidence, the incidence, din ako. The incidence of schizophrenia and related disorder is higher for children growing up in an urban environment and for some minority ethnic groups. Next risk and prognostic factor is the genetic and physiological. There is a strong contribution for genetic factors in determining risk of schizophrenia. Although most individuals have been diagnosed with schizophrenia, have no family history of psychosis. So, yun nga. Next is gender-related diagnostic issues. A number of features distinguish with clinical expression of schizophrenia in females and males. The general incidence of schizophrenia tends to be slightly lower in females, particularly among treated cases. Suicide risk naman ng schizophrenia, approximately 5% to 6% of individuals with schizophrenia die by suicide. About 20% attempt suicide on one or more occasions, and many more have significant suicidal ideation. Siyempre, pag may schiz ka, hindi ka daw normal for some people na hindi nakakaintindi. That is why siguro yung suicide risk niya is medyo taas. Next is the differential diagnosis. What are the differential diagnosis in schizophrenia? So, first is the major depressive or bipolar disorder with psychotic and catatonic features. The distinction between schizophrenia and major depressive bipolar disorder with psychotic features or with catatonic depends on the temporal relationship between the mode disturbance and the psychosis, and on the severity of the depressive or manic symptoms. If delusions or hallucination occurs exclusively during a major depressive or manic episode, the diagnosis is depressive or bipolar disorder with psychotic features. Next is the schizoaffective disorder. So, a diagnosis of schizoaffective disorder requires that a major depressive or manic episode occur concurrently with the active phase symptoms, and that the mode symptoms be present for a majority of the total duration of the active period. Next is the schizophreniform disorder and brief psychotic disorder. These disorders are shorter duration than schizophrenia, as specified in criterion C, which requires 6 months of symptoms. In schizophreniform disorder, the disturbance is present less than 6 months. And in brief psychotic naman, ang symptoms ay present siya at least 1 day but less than 1 month. So, hindi masyadong matagal yung brief psychotic disorder tsaka yung schizophreniform kasi nga present less than 6 months, wherein yung iba is nag-last siya for almost a year, yung mga pareha sa mga schizophrenia. Sa mga delusions, 1 year, yun no? Delusions, diba? Totoo na. Delusional disorder. Delusional disorders can be distinguished from schizophrenia by the absence of the other symptoms characteristics of schizophrenia. For example, delusions, prominent auditory and visual hallucination, disorganized speech, grossly disorganized or catatonic behavior, ara siya dito sa ang mga symptoms sa mga characteristics ng schizophrenia. So, same sila. Okay, next. Schizotypal personality disorder. So, it may distinguish from schizophrenia by threshold symptoms that are associated with persistent personality features. Next naman is the obsessive compulsive disorder and body dysmorphic disorder. Individuals with obsessive compulsive disorder and body dysmorphic disorder may present with poor or absent insight, and the preoccupations may reach delusional proportion. But these disorders are distinguished from schizophrenia by their prominent obsessions, compulsions, preoccupations with appearance or body odor, hoarding, or body-focused repetitive behavior. Next is the post-traumatic stress disorder. Post-traumatic stress disorder may include flashbacks that have a hallucinatory quality, and hypervigilance may reach paranoid proportion. My God, lapit na ta. Proportions, but a traumatic event and characteristic symptoms features relating to reliving or reacting to the event are required to make the diagnosis of post-traumatic stress disorder. So next is the autism spectrum disorder and communication disorder. These disorders may also have symptoms resembling the psychotic episode but are distinguished by their respective deficit in social interaction with repetitive and restrictive behaviors and other cognitive communication deficits. An individual with autism spectrum disorder or communication disorder have symptoms that meet full criteria for schizophrenia with prominent hallucination or delusions for at least 1 month in order to be diagnosed with schizophrenia or comorbid condition. Last is the other mental disorders and associated with psychotic episode. The diagnosis of schizophrenia is made only when the psychotic episode is persistent and not attributable to the physiological effects of the substance or another medical conditions. Individuals with delirium or major or minor neurocognitive disorder may present with psychotic symptoms, but this would have a temporal relationship to the onset and cognitive changes consistent with those disorder. So what is the comorbidity? Rates of comorbidity with substance-related disorder are high in schizophrenia. Over half of the individuals with schizophrenia have tobacco use disorder and smoke cigarettes regularly. Okay? So, huwag kayo masyadong kung ayaw nyo magka-schizophrenia, iyasan nyo na magtabako or mag-smoke. Kay, hindi lang sa skids, pati sa lungs, may sakit yan siya. Next is the schizoaffective disorder. So, sa diagnostics ng schizoaffective disorder, first sa criterion A, dalawa na lang guys. Dalawa na lang. Chill lang kayo dyan. Uninterrupted period of illness during which is a major mode episode or the major depressive or manic concurrent with criterion A of schizophrenia. Criterion B, delusions or hallucinations for 2 or more weeks in the absence of major mode episode or depressive or manic during the lifetime duration of the illness. C is the symptoms that meet criteria for major episodes are present for the majority of the total duration of the active and residual portion of the illness. D is the disturbance of not attributable to the effects of the substance or another medical condition. Specify naman natin dito if it is a bipolar or depressive type. This subtype applies in a manic episode is part of the presentation. Major depressive episodes may also occur. Yan yung sa bipolar. Pag sa depressive type naman, applies if a major depressive episodes are part of the presentation. Tama ba ko? Dumali lang ito. Tama ba to? O tama dahil ito. Tama. And of course, with catatonia, specify din natin the following core specifier. It can only be used after 1 month, 1 year, 1 year duration of the disorder, and if they are not contradiction to the diagnostic criteria. First, episode current in acute episode. First manifestation of the disorder meeting defining diagnosis, symptoms, and time criteria. Acute episode is the time period in which symptoms criteria are fulfilled. So next is the partial remission. It is the time period which an improvement after a previous episode is maintained and in which the defining criteria of the disorder are only partially fulfilled. So half na guys. Sa full remission naman is a period of time after a previous episode during no disorder specific symptoms are present. Diba ka perfect? Next is the multiple episode. So multiple episode may be determined after a minimum of 2 episodes. So for example, after first episode, magkaroon ng remission and then minimum of 1 lapse na lang. Next is the diagnostic features. Ay, i-discuss pa ba ang severity? Itanaw nyo na lang sa written report para dito. Kaya hindi man siya gyapon hindi naman kasi siya kasali or parang makagawa ka rin naman ng diagnosis sa schizoaffective disorder without using the severity specifier. But if you want to know the current severity of this disorder, you can download my written report to the Google Drive na gipost ni Ate Weng. So, diagnostic features of schizoaffective disorder is based on the assessment of an interrupted period of illness during which the individual continues to display active or residual symptoms of psychotic illness. The diagnosis is usually but not necessarily made during the period of psychotic illness. So, what are the associated features supporting the diagnosis? So, paano nasabi na yan yung mga diagnostic features? So, dito natin makikita sa associated features. So, there are no tests or biological measures that can assess in making the diagnosis of schizoaffective disorder, whether schizoaffective disorder differs from schizophrenia with regard to associated features such as structural or functional brain abnormalities, cognitive deficit, and genetic risk factor is not clear. So, prevalence ng disorder na to, schizoaffective disorder appears to be about 1/3 as common as schizophrenia. Common siya masyado. Lifetime prevalence of schizoaffective disorder is estimated to be 0.3. The incidence of schizoaffective disorder is higher in females than in males. So, mas nangyayari siya sa mga babae. Oh my God, babae. Babae. Okay. Mainly due to an increased incidence of the depressive type among female. So risk and prognostics of factors, of course, first is the genetic and physiological. Among individuals with schizophrenia, there may be increased risk of schizoaffective disorder in first-degree relatives. The risk for a schizoaffective disorder may be increased among individuals who have a first-degree relative with schizophrenia, bipolar disorder, and schizoaffective disorder. There are cultural-related diagnostic issues. Sa cultural and socio-economic factors, it must be considered, or particularly when the individual and a clinician do not share the same cultural and economic background. Ideas that appear to be delusional in one culture may be commonly held in another. So, ano ba mga suicide risk ng schizoaffective disorder, no? So, the lifetime risk of suicide for schizophrenia and schizoaffective disorder is 5%. So, dako siya kayo kay 5%. And the presence of depressive symptoms is correlated with high risk of suicide. Oh. The differential diagnosis for schizoaffective disorder are first is the other mental disorder and medical conditions. Oh my God, lapit na ta. After isa na lang. So, listen. A wide variety of psychiatric and medical condition can manifest with psychotic and mood symptoms and must be considered in differential diagnosis of schizoaffective disorder. This includes delirium, neurocognitive disorder, substance-induced psychotic disorder, or neurocognitive disorder. So, bipolar disorder with psychotic features, major depressive disorder with psychotic features, depressive or bipolar disorders with catatonic features, schizotypal, schizoid, or paranoid personality disorder. Yun yung mga sa other mental disorders or medical conditions. Next is the psychotic disorder due to another medical condition. So, other medical condition and substance use can manifest with a combination of psychotic and mood symptoms. And the psychotic disorder due to another medical condition needs to be excluded. So, next is differential diagnosis is the schizophrenia, bipolar, and depressive disorder. So, distinguishing the schizoaffective disorder from schizophrenia and from depressive and bipolar disorder with psychotic features is often difficult. Criterion C is designed to separate schizoaffective disorder from schizophrenia. Criterion B is designed to distinguish schizoaffective affective disorder from a depressed or bipolar disorder with psychotic features. So, more specifically, schizoaffective disorder can be distinguished from a major depressive or bipolar disorder with psychotic features based on the presence of prominent lesions or hallucinations for at least 2 weeks in the absence of major mood episode. So, we are here. We are about to end na ang ating report. Malapit na. Last na lang ito, guys. So, our last disorder is the substance medication-induced psychotic disorder. So, what are the diagnostic criteria for this disorder? First, criterion A is presence of one or both of the following symptoms, the delusions and the hallucinations. So, most specifically, nangyayari yung delusions and hallucinations since it is a substance or medication-induced psychotic disorder. So, etong mga psychotic disorder na ito ay because of use, kay may mga ginagamit na mga drugs, ganon. Drug of abuse, mga ganon. There is, criterion B, there is evidence from the history of physical examination or laboratory findings of both 1 and 2. The symptoms in criterion A develop during or soon after substance intoxication or withdrawal or after exposure to a medication. Bawa, meditate tapos may arat na siya ga-occur na ng mga delusions and hallucinations sa iya. Kasulod na siya sa 1. The involved substance medication is capable of producing the symptoms in criterion A. Yun na nga. That's what I said. So, sa criterion C, disturbance is not better explained by psychotic disorder that is not substance medication induced. Such evidence of an independent psychotic disorder could include the following. The symptoms preceded the onset of the substance medication use. The symptoms persist for substantial period of after the cessation of acute withdrawal or severe intoxication, or there is an other evidence of independent non-substance medication induced psychotic disorder. Criterion D, the disturbance does not occur exclusively during the course of a delirium. D, the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So, what do we need to specify in here? We need to specify with onset intoxication. So, if criteria are met for intoxication with the substance and the symptoms developed during intoxication. With onset during withdrawal, if criteria are met for withdrawal from the substance and the symptoms developed during or shortly after withdrawal. And lastly, with the onset after medical use, after na ng mga nangyari, if symptoms develop or at initiation of medication with a change in use of medication or during withdrawal of medication. So, specify natin ang current severity nito. Meron ako dito. So, current severity. Severity is rated by the quantitative assessment of the primary symptoms of psychosis, including delusions, hallucination, abnormal psychomotor behavior, and negative negative symptoms. Each of these symptoms may be rated for its current severity. Most severe in the last 7 days on a 5-point scale ranging from 0 not present to 4% and severe. Let's note that yung diagnosis of some substance medication-induced psychotic disorders can be made using the severity specifier. So, kakagawa ka pa rin ng diagnosis without the severity specifier. So, what are the diagnostic features? The essential feature of substance medication-induced psychotic disorder are prominent delusions or hallucinations that are judged to be due to the physiological effects of the substance or medication. For example, a drug of abuse, a medication, or a toxin exposure. So, karaniwan sa mga nagkakaroon na ganito ay yung mga addict. Char lang. Yung mga drug of abuse, yung mga may effect yung mga bulong, yung mga gamot na ini-intake nila or yung sa mga mahilig mag-experiment na nagkaroon na ng intoxication exposure, na parang nabuang na sila. Ay, paano ba? Not the right term. Basta parang iba na yung nagkakaroon na sila ng hallucinations and delusions. Ganon. So, what are the associated features supporting diagnosis? Psychotic disorders can occur in association with intoxication with the following classes of substances. Example is the alcohol, cannabis, mga palubog dara, mga adik-adik dara, hallucinogens, including the phencyclidine, or related substances like inhalants, sedatives, hypnotics, and anxiolytics. Tama ba ko? So, stimulants like including the mga cocaine, oh my God, and other or unknown substances, mga party drugs, mga mugunogoro na. So, psychotic disorders can occur in association with withdrawal from the following classes of substances. Ang psychotic disorder, mangyayari lang siya kapag nangyari na yung parang hindi na good ma-sustain ng alcohol, mga sedatives, yung hindi na good, tawag dyan? Can occur association with withdrawal from the following classes of substance. Parang nangyayari itong psychotic disorder na nakalagay sa nangyayari itong psychotic disorder if mag-withdraw ka na sa ginagawa mo noon, like sa alcohol, sa sedatives, ganon. Psychotic disorders can occur in association of intoxication with the following classes of substance. O, diba? Nag-ulit na naman ko. Sa prevalence na tayo, guys. Sorry, kasi nag-ulit yung prevalence of substance medication in those psychotic disorder in the general population is unknown. Hindi pa natin alam. So, between 7% and 25% of individuals presenting with the first episode of psychosis in different settings are reported to have substance medication in those psychotic disorders. So, mataas-taas yung parang sa first episode good ng psychosis, mataas yung numbers of patients, patients na because of substance or medication induce yung pagkakaroon nila ng psychotic disorder. Yung mga, alam naman natin, marami na sila, naglipanan na sila sa mga palengke and everything. So, what are the differential diagnosis for substance medication induced psychotic? Tatlo lang, pa-end na ta. So, first is substance intoxication or substance withdrawal. So, individuals intoxicated with stimulants, cannabis, or opioid, meperidine, or penicillin, parabi siya sa mga pharma good, or those withdrawing from alcohol or sedatives may experience altered perceptions that they recognize as drug effects. In reality, testing for this experience remains intact. For example, the individual recognizes the perception of a substance in dose and neither believes in nor act on it. The diagnosis is not substance medication induced psychotic disorder. Instead, substance intoxication ang tawag doon or substance withdrawal, the perceptual disturbance. For example, sa cocaine intoxication with personal disturbance, flashbacks, hallucinations can occur long after the use of hallucinogens. Hastap are diagnosed of hallucinogen persisting perception disorder. So, if substance medication induced psychotic symptoms occur exclusively during the course of delirium, as in severe forms of alcohol withdrawal, the psychotic symptoms are considered to be an associated feature of the delirium and are not diagnosed separately. So, delusions in the context of a independent psychotic disorder. Psychotic disorder due to another medical condition, major or mild neurocognitive disorder, would be diagnosed as major or mild neurocognitive disorder with behavioral disturbance. Okay? So, next is the psychotic disorder due to another medical condition. So, a substance medication induced psychotic disorder due to a prescribed treatment for mental disorder or medical condition must have its onset while the individual is receiving the medication. Or, for example, during the withdrawal, if there is a withdrawal syndrome associated with the medication. Because individuals with medical conditions often take medication for those conditions. The clinicians must consider the possibility that the psychotic symptoms are caused by the psychological consequences of the medical condition itself rather than medication. So, in which case psychotic disorder due to another medical condition is diagnosed. The history often provides the primary basis for such a judgment. At times, a change in the treatment for the medical condition, for example, medication substitution or discontinuation, may be needed to determine empirically for the individual whether the medication is the causative agent. If the clinician has ascertained that the disturbance is attributable to both a medical condition and substance medication use both diagnosis. For example, psychotic disorder due to another medical condition and substance medication in those psychotic disorder may be given. So, the last differential diagnosis, oh my god, last na. The psychotic, other specified or unspecified spectrum, schizophrenia spectrum, and other psychotic disorder. So, the psychotic symptoms, the psychotic symptoms include in the diagnosis of substance and medication in those psychotic disorder are limited to either delusions or hallucinations. So, individuals with other substance in those psychotic symptoms, for example, disorganized or catatonic behavior, or disorganized speech, or mga naga-word salad na basyadura, incoherence, or irrational content should be classified in the category other specified or unspecified schizophrenia spectrum and other psychotic disorder. So, that's the end of this slide. Oh my god, congratulations. I hope you learned something from what I've discussed. That's all. Thank you.